All right. Hi, everybody, and welcome to our next webinar, webinar number 6. And just a little update, some exciting news. Pathway Inclusion Center will be opening starting next Monday, June 1st. So we are looking forward to seeing all of our families again. And if you are looking for childcare or tutoring, dyslexia services, behavior services, anything like that, please give us a call. Our number is on our Facebook page. And I hope you all are staying healthy and well. And today we are going to be talking about resources for children with hearing loss. And joining us, we have Batul Berry. So welcome, Batul. Batul and I met through the Myland program, the Michigan Leadership Education and Neurodevelopmental Disabilities program. And she is a doctoral student in audiology at Wayne State University. And she's currently at the Henry Ford Health System, and she has a lot of experience working with patients with neurodevelopmental disabilities. And so we are very excited to kind of have a change of topic today and learn something new from you. And so thank you for joining us.
Of course, thanks for having me.
All right, so let's go ahead and get started. So first, can you just explain kind of what audiologists do exactly, and maybe the benefits and support they can provide for children and families with hearing loss?
Absolutely. And my entire PowerPoint covers all of that as we transition into the resources.
Okay,
Yeah.
Perfect. So I'll go ahead and...
Perfect. So I always like to give some kind of stats when it comes to hearing loss. It does occur 1 out of every 1,000 births. There are genetic factors that account for at least 60% of childhood hearing loss. And I think the most important thing to remember is 90% of children born with hearing loss are born to hearing parents. It is a recessive genetic component to have. So sometimes both parents are normal hearing and the child is born with hearing loss. Now, of course, there are risk factors that can put them at a greater risk, and that would be on the next slide.
Okay.
So common risk factors, and these are risk factors that, at least in Michigan, and I believe across the United States, that if a child meets some or all these criteria, we would monitor as they developmentally grow older. So if they have a NICU stay of 5 days or greater, they are at a greater risk of progressive hearing loss. So we will monitor them then. Any of the following, regardless of NICU stay, is hyperbilirubinemia, one, assisted ventilation, just because think of it as just the loud noise exposure, or any ototoxic medication. So ototoxic medications are meds that they need to get better and, make it home healthy and well, but these meds could cause hearing loss.
Okay.
Any family history of hearing loss, especially if it's immediate family, we would want to monitor that child. Also, we always kind of keep in mind if family has concerns. If the family is concerned, then we need to be concerned because families know their children best.
Mm-hmm.
Any in utero infection, CMV is the big one, or if we notice craniofacial anomalies on the child, then to us those are red flags that we need to monitor the kiddo.
Okay.
What does monitoring mean? So for us, we would every child gets screened at birth for hearing loss if they pass or they refer, but in the chance that most of them do pass, but they meet these risk factors, we would follow them up at 6 months of age, and then 1, 2, and 3 years. By then they transition out, mainly because they start getting enrolled in schools, and the schools give school screenings every other year. So they tend to catch them once, they transition out of the program.
Okay.
Next slide, please, Carrie. Thank you. So to your question, who are audiologists and what do they do? So we evaluate, diagnose, treat, and manage hearing loss and balance disorders. So with balance disorders, most people don't realize our balance organs connected to our hearing organ. That snail-looking shell, our balance organs are the 3 canals that you see, the semicircular canals. It's all embedded in one. So in order, some patients have balance disorders with no hearing loss, or hearing loss and no balance disorders, or both.
Okay.
We perform hearing tests at all ages, hearing aids, and then cochlear implants if hearing aids aren't sufficient for someone's hearing loss. Now, for cochlear implants, you would need additional training and expertise in order to do that. We do implement hearing conservation programs. Newborn hearing screenings is what I started off talking about, and just hearing rehab training overall, not just with children, but if someone develops hearing loss when they get older, their normal is different, right? Especially just getting used to hearing aids and getting used to a new normal takes time and takes practice. So
okay,
training there is good. Next slide, please. Oh, and then I think I added an effect. I got a little fancy on one slide. Keep going. So yeah, audiologists, where do they work? Private practice is one, hospitals, educational institutions. There are educational audiologists that if a child does have hearing loss, it's someone that can be there remotely for them, and the school system. The VA has hearing aid services and audiologists working there. Industry, just pretend the A at the end of it isn't there. Entertainment, some work for OSHA, the hearing conservation, just working in factories and noise and monitoring that, and the government. Like I said, the VA has audiologists there as well.
Okay.
Next slide. One thing I do want to mention about the VA, any veterans do have hearing aid benefit. So regardless of their insurance. So if someone has served in the military, we always refer them to the VA because they deserve hearing aids at no charge. And that's usually what we do, is we refer them to the VA if they do come into the hospital system.
Okay.
For families, what do you expect? I mean, just knowing your kid referred in the beginning, when it's a baby, it's new and exciting, but it's also overwhelming to get that news. So initially when they're screened at birth, it's just a quick screener to see if it's a pass or fail. It's not a diagnostic one to see how much do they hear and what's causing the hearing loss.
Right.
So they are checked at a few days of the few first days of life in the hospital. We tend to wait at least 24 hours before discharge. So we don't want to test them right when they're born. They're still, itty bitty. So the closer they are to discharge, that's the most optimal time for us to test them. Okay. We also don't want to test them in the beginning. And then if they're giving any medication, like I mentioned, that's ototoxic, or they're on a vent, then that might potentially cause hearing loss. And then we would have missed that because we did it prematurely.
Okay.
So you should receive the results from the hospital almost immediately, especially before discharge. They will let you know what are the most common reasons someone needs a rescreening. Sometimes there's fluid in the baby's ear. It could just be from the birthing process. Sometimes I call it gunk, gets left in the ear canal. Sometimes it's fluid behind the eardrum that we need to address. Yeah. The testing room can be too noisy. It's important to know, especially in the NICU, there's so many electrical artifacts happening that being too noisy could be one. The baby can be restless and fatigued in a sense if they're crying, and muscle responses are so much stronger. So it can, in a sense, not give us an accurate reading, and they would refer. Okay. Or baby does have hearing loss, and those are the ones we truly want to monitor and make sure they get the help and resources that they need. Right. Hearing screenings will only tell you if there's a possibility of hearing loss when they get screened before it doesn't tell you, again, that full diagnostic hearing test would.
Right. Which they would get later at like a follow-up appointment.
Yeah. So traditionally they should make the appointment before they're discharged. They would say, your child failed or passed one of the ears. We need to make an appointment for you to follow up with audiology by at least 1 month. Okay. So I think I presented on this on LEND. Remember the 1-3-6 rule. We want to we get them back in by 1 month of age. So in case we do diagnose hearing loss, we want to start the process and make sure they get hearing aids as soon as possible.
Right. Okay.
Next. So this is, it's called an ABR, auditory brainstem response. This similar to what a diagnostic test would be on a child. So this is a diagnostic screen. We would put like stickers on his forehead, behind his ear, But again, every equipment looks different, but essentially that's what it would be. With this test, if your child is, we always say bring them hungry and bring them tired, because if you're feeding them during testing and they're asleep, we will get a beautiful response, be able to get as much information as we can. So we would start the diagnostic screen, but just presenting a sound at a conversational level. If that looks nice and healthy, we keep dropping down to try to figure out what's going on.
Okay.
Now, I will say one thing parents don't realize: if there is fluid or any gunk in the ear, it doesn't mean the response is absent. For us, it would mean it's pushed out. So we would see it. We would say, oh, it looks like a temporary hearing loss. We would add additional testing, like a bone oscillator headband behind the ear or something like that.
Okay. Okay.
So if you get if like your child does refer, they would in that appointment at least know, granted, given how well the child is sleeping and restful at that
Okay.
point. Next slide. So I put pictures of different things. So one thing I always get from family is like, the last person didn't do this, or this looked different than last time. What are they doing to my kid during testing?
Mm-hmm.
So there are different ways we can assess a child's hearing ability. So one could be where they have you put them in your lap. We always tell the parents, I want you to pretend you're a chair. I don't want you to cue turning when the speaker sounds coming on at all. So that one would, like that first picture there with the dad and his child. So if we would present a sound to the speaker on the left or to the right, and then we would watch if the child, he or she doesn't necessarily have to turn left or to the right, but we're able to pick up on some behavioral cues too, just to see if there's a response.
Mm-hmm.
And that's when I always say it's important to go to pediatric audiologists, because they're trained to pick up these subtle cues if they're present. But for this test, it doesn't really give us ear-specific information in a sense. Is it the left ear that's hearing it or the right ear?
Mm-hmm.
So that's when we would add additional testing in that appointment to truly assess the right and truly assess the left as well.
And are the lights and like the fun little animals there as kind of like a reward for?
Yeah, that's exactly it. Just conditioning them. Oh, you heard the sound. This is where it was coming from.
Okay, so they hear the sound first, and then they look over, and the light comes on, and they see. Okay.
Mm-hmm. So they should never turn on the reinforcement if the child is just looking for it. It should be a reward, like you said. So once they turn, you're correct, this is it. So then they're trained to, once they look, that's when they're given that puppet or that. Now they're all probably on screens.
Right.
Yeah. Okay. As they get older, we start to play a game. It's like when you hear the birdie, put the ball in the bucket, or let's listen carefully. Let's listen for the monkey. And then that's when we condition them with that. They are wearing headphones. Mm-hmm. So we can truly assess the left and the right ear individually. But then we make it a fun game. I would say by 2 years of age, but it does depend on the child. Some can do it earlier than 2 years. Some can't do it till 3, and that's okay. It doesn't mean there's something wrong. It's just, listening to beeps and putting toys in buckets aren't as exciting as we think it is.
Right.
Okay.
Yeah, I went through this process with my daughter when she was maybe 3 years old, I think. And they, of course, had a difficult time getting her to respond to different types of tests. I couldn't even tell you which ones they did. The first 2 both look familiar to me, but because of her autism, it was hard to get her to engage. Mm-hmm. And also, I don't know if you go into more detail on this, but I took one of the trainings that Myland offered, and it's online and it's available to everyone. And I learned that all of these tests have like the different names, and there's even more than what's here. So if parents want to like go into more detail about like what these different tests are called or something, I can share that resource with them later. I can't remember right now who it was through, but yeah. So that was the first time that I'd really seen it broken down to where like parents could, or non-audiologists could understand the differences between all the different assessments.
Right. And I feel like sometimes parents come in like a little like deer caught in house, like what's happening? Like, sit them down. It's very important to put them at ease, because if the parents are at ease, the baby's at ease.
Right.
Even when someone comes in just for like the ABR, the first test I had shown,
Mm-hmm.
if the mom is stressed at all or anxious, which rightfully so, right? You're either going to get
Right.
a diagnosis of hearing loss or you're not. The baby picks up on that. And then the baby starts to become squirmy and moving. So the first thing to truly is put the parents at ease and tell them what to expect before you surprise them with
Right.
testing.
Yeah.
And yes, there are so many more tests than this.
Yeah.
And this is just generally how we would test the hearing itself, not whether the ear is healthy or not. We will look in their ears and make sure the eardrum's moving and healthy and there's no
Mm-hmm.
fluid behind there.
Mm-hmm.
And we always have to keep things in our back pocket because kids are constantly on the go. So if one thing isn't working, we need to adapt and we need to change testing as quickly as we can to keep their interest, because like I said, testing isn't fun and it's a foreign environment to them. So we have to make it as fun as we can.
Right.
As they get older, we do the whole raise your hand or press the button when you hear the beep. That's similar to what adults get. It's the diagnostic, just standard conventional method to do it.
Okay.
And some kids do it early. Some kids still want the bucket even though they're capable of raising their hand. And that's what they do. One thing I will say is sometimes we don't get the full picture with these tests right away.
Okay.
I always tell the parents that, if we answer some of the questions today, that's an amazing thing.
Progress.
That's progress. We need to bring them back. We need to not exhaust the kid, because if they're exhausted, they're not going to give us any information. And you also don't want to traumatize them that they don't want to come back for further testing. So even if we have to do a little bit today, a little bit next week or the week after, it's okay. In the end, we will get the full.
Okay.
Yeah, like one example, I had a kiddo that didn't want anything in her ears at all.
Yeah.
And we were worried about unilateral hearing loss, meaning on one side. So putting her in the lap and turning the speakers, okay, she can hear, but we want to truly assess that one ear individually. And there are additional tests we can do where we would need to put something in her ear to test hearing, even objectively. And she wouldn't let us do. So we just told mom and dad, when you go home, practice putting headphones on. Even if it's just connected to an iPad, just that practice. When she comes in, she truly, then when it's funny, and when she came back 4 weeks later, she grabbed the headphones and just put them on.
That's
she got used to it. It's little things that you're they're not used to putting headphones on. You don't want to just force them and then,
And you said testing objectively. Can you explain what the difference is between that and some of the other more subjective tests, I guess?
Yeah, so it's one where they don't really need to respond. So an ABR is one. One is called OAE, otoacoustic emissions, where we would send a signal to the hearing organ. We'd measure their echo essentially. Just to make
there are ways to measure hearing loss even if a child is not engaging or not responding or following directions.
Yes, but just because someone, for example, referred on an OAE, it could be, is it fluid? Is it, it rules out everything but a mild hearing loss, so we would still miss the ones that are mild. The ABR is really the gold standard.
Okay.
It's one that if we can sit them through for that hour, we can gather as much information.
Okay.
Next slide, please. Oh, yes. So now I added some, I have to remind myself, these are resources to support their children that do have hearing loss. So on the next slide, I have little things, things that just parents can do if their child has hearing loss and has hearing aids. Just check their hearing aid technology every morning to ensure it's working. And this is something parents are shown the minute they get the hearing aids during that delivery process, because kids aren't great historians. They're not great reporters. Sometimes they can put it on, but is it off or is it muted? Little things like that, or is it plugged with wax? So parents can every morning do a listening check on the technology. It would be great.
Okay.
Ensure the battery's working well. Although I will say now rechargeability is dominating the market, even for pediatrics. So just making sure it charged overnight would be, so not as many people are changing batteries anymore.
That's good.
So these are link sounds. It's the a, oo, e, sh. It's a lot of these consonants and vowels that we want kids to make sure they're hearing.
Okay.
So, for example, if they do a listening check and they're just talking into the hearing aid, ah, ooh, ish, and if it's coming in good, then we know they're at least picking up those sounds.
Okay.
Again, just ensuring it's free of wax, cracks, or moisture. The audiologist would also, would have established care once the kid is diagnosed with hearing loss. They have their pediatric audiologist who does the annual checks or the 6-month checks with them.
Okay.
And I think just right now, being quarantined, try to reduce background noise. I know it's hard, but with everyone being home, it's like stimulation overload, right?
Yeah.
There's a lot going on. Closing windows and doors if there's noise coming from outside can help. Turning off or just moving any noisy like appliances, or like if the sibling's on the iPad and they're doing something, it's a lot for like the brain and the hearing aids to just try to pick up on. It's distracting.
Right.
I think it's just some things to keep in mind.
Okay.
Moving away from people that are talking or making noise. For example, if they're working on homework and they're trying to focus, but the TV's on or someone's on the iPad and there's noise coming in and the hearing aid's amplifying that noise, they're just getting stimulation when they just want to be focused on that homework.
Right.
It's just things to kind of keep in mind.
Okay.
On the next slide, I have 2 more. Yes. And then visuals and positioning to aid understanding, in a sense that while, yes, we're trying to reduce the noise, the auditory input, but we also need to reduce visual input and try to help as much as we can and provide visual input where needed, meaning sometimes providing like a visual picture while explaining a concept can help. Just kind of putting the two together. Remembering that children with hearing loss require more than just amplifying sound. They need the best possible visibility for that to happen. So making eye contact when you're talking to them, make sure you're facing them, make sure they can see your face, and not necessarily that we want them to just read lips, but that can help in aiding the understanding and picking up language and taking a moving break. I think one thing is there's a cognitive load that listening has, right? I mean, we feel it sometimes, but like, I'm just burnt out today and I didn't do anything to talk.
Right.
And for kids, it's no different. It's exhausting. And just having the hearing aids on and constantly, with kids, we want them to wear it all the time. That's one thing I've noticed with families in quarantine. It's like, oh, he's at home or she's at home. She doesn't need to wear it. But it's important to remember kids are incidental learners, meaning they're picking up everything from the environment and we want them to.
Right.
We want them to pick up the conversation, that not necessarily eavesdropping, but if, for example, if, the mailman's knocking or the phone's ringing, like these are sounds and environmental we want them to pick up because it's incidental. That's how they learn. They're learning language by just hearing it around them, not necessarily if they're conversing with you about it.
Right.
So when you're at home in quarantine, try to still keeping that routine, wear the hearing aids as much as, eyes open, ears on is the best thing I can tell families. Just making sure it's on. And again, if they're exhausted and drained, I'm not saying keep it on all the time, even if it's okay to take a break.
Right.
But just making sure he or she's wearing it more often than not.
Okay.
Especially in the early stages, that critical period when we want them to learn all the language cues, all the consonants and the vowel sounds.
Right. Okay.
And then a good stretch and stand up and exercise doesn't harm anyone. I mean, we do it. We did it.
That's good for everybody, I think.
It's just like a family powwow. Let's get up and do some exercises for sure.
Yep.
Next slide. These are great things someone shared online that, I thought would be helpful to share here too. Most of you may have seen it, the mask with the clear insert where someone
the
I love
those. Yeah.
Yes. They're hard to find and get a hold of, but some families are so creative. They're just making them.
Wow.
So, those are super cool. And then especially with the mask on, slow, clear, and loud speech, it does muffle sounds a little bit with having a mask on, with or without that clear mask. So we need to just slow it down, make it clear, and just be as loud, but not like screaming at them, right? We just want to make it loud enough that they're getting it. Ensure adequate lighting. Although with the clear mask, they can see your lips, but if you don't have that, you are wearing a mask, lighting in a sense, they can still pick up body cues and like your eyes, are windows to the soul. So they can still pick up on some of that language. Oh, is she mad? Is she happy? Is she sad?
Right.
On that.
Yeah.
And always remember to face the individual. It's the best strategy you can do, even for adults with hearing loss. Face the person.
Yeah.
It's the best way to truly communicate and converse.
Mm-hmm.
There are transcription apps. I believe on the next slide I have I have 3 apps that I recommend for families. Yes. So these are apps that, especially for children with hearing loss that are in high school or in grade school, and they're now doing in the Zoom classrooms and stuff like that. These are live apps with that transcribe what's going on live for them. So think of it like a closed caption. It would help. So the live transcribe gives you speech to text access. It's actually built by Google in partnership with Gallaudet University.
Oh, okay.
Yeah, Text and Hear is also a great one. I've heard a lot of great reviews from Ava. That one, it's more sophisticated than the rest of from what I gather, and they also have one where it has a group convo capability, so it can pick up the different speakers and help with the classroom aspect of it. So these are just ones that families anecdotally have shared and told me have worked.
Okay.
So it's worth a try. I believe all 3 of them are free, so it doesn't hurt. Even for adults, that's something you're like, I'm exhausted listening to all these Zoom meetings. Let's see if they'll just transcribe it live for me.
Yeah.
I'm reading a text, and kids love reading text. So
yeah. So about that, I attempted to use so Google Slides has captions. You can put captions on, and I attempted that with some of our first webinars, but it doesn't pick up the guests' words. And so it was only typing out my words. And I was like, well, that's not helpful. So I don't know what the solution is for that, but yeah, maybe some of these would be more useful than that was.
yeah, it's worth a try. I mean, I was even thinking like during our Zoom sessions, I recommended they add closed captioning.
Yeah.
Just sometimes you don't know who's talking.
Right. Yeah.
You're like, what's being said, or they ask a question and you're like, I missed that, because again, there's so much stimulation. There's so many faces on there, and like the slides are going on at the same time. So any help is good, I think.
Yeah.
So this is a hearing loss simulator.
I'm excited about this.
Okay, good. I don't
want to
know.
like introduce it?
I'm gonna try. If you can just play it for me. The nice thing about this is they'll show you with and without hearing loss how sounds are being perceived.
Okay.
And this was shared by Phonak. It's a hearing aid company that also provides pediatric hearing aids. Let's see if it worked. Can you hear that?
Oh, wow.
How it feels like, not that they can't hear, just turn down and muffle the clarity of speech. Thing. Music is a big one.
Wow.
Mm-hmm.
So what level of hearing loss is this?
So
or do we not know?
Yeah, so these are just mild to moderate hearing losses.
Okay.
But again, every hearing loss is...
Sorry.
No,
it was my fault.
Well, more moderately severe. Slopes down.
Okay. I don't even know what she's saying.
Yeah. Do you mind pausing it there real quick? I don't know if I'll if not, let's keep going. Okay. One thing about speech and cards, just remembering when you know you pick up your kids from school or they're in the back after practice and you're like talking to them, they're not always picking up what's being said.
Yeah.
Think of the road noise like you heard or all that. It's muffled,
Right.
right? But
Mm-hmm.
again, you're experiencing that and hearing it without a hearing aid. Now, hearing aid theoretically
Right.
should be amplifying and helping out, but just something to keep in mind. There's
Mm-hmm.
a lot of noises coming in.
But the hearing aid will be amplifying all the sounds, not just
Where
the
needed.
speech, right?
So yes. So hearing aids are prescribed based on the hearing loss. So if someone has, for example, normal to mild or normal to moderate, it's
Mm-hmm.
not going to amplify the frequencies that are in the normal range because the ear is naturally hearing those sounds.
Okay. Okay.
It's like where are the frequencies that are missing and where can we give them a boost where needed.
Okay.
Mm-hmm. Not that kids are watching the news, but if they are, you know, into it, hey, especially the Weather Channel.
Oh my gosh.
No, I will say we have a few adult patients that come in and say after they got hearing aids, I can finally hear the birds chirping.
Oh my gosh. I love listening to the birds.
Mm-hmm. Again, it's we're hearing them incidentally, right? Like we're not sitting there waiting for them. I mean, unless you're a bird watcher, but if you're walking around,
Yeah.
you hear like a bird, like these are things that we're picking up just by being in the park that someone
Right.
else may not.
Yeah.
I will.
That was so cool. Thank you for sharing
Of
that.
course, I always think it's good to give parents some kind of hearing loss simulator. Now, the nice thing in clinic is that we can plot in the child's hearing loss
Okay.
in like on an actual speech mapping device and show them this is what your child hears based on your
Wow. That is so
like, this
cool.
just gives you a mild to moderately severe hearing loss, but some
Okay.
have mild. It can have a flat moderate or moderate rising to normal, like in the other sloping the other way. But that's the nice thing about having them come in and hearing it. They'll truly know what's being missed.
Mm-hmm.
I will
Yeah.
say for a long time, children with mild hearing loss haven't been getting amplified in a sense. Well, it's mild. They can still hear. They're still going to learn speech and language, right?
Mm-hmm.
But providing that research has shown that even kids with a mild loss have this cognitive load at the end, that if we can help them in any way, they'll do a lot better academically and in life.
Yeah.
So a simulator like that would be like, oh, like it's not as clear, or if you add background
Right.
and it's just, it's helpful to hear. Even
Yeah. Yeah.
like adults, like you're like, oh, that's
I,
what.
we, I know we have like autism simulators too. There's some videos on YouTube that I've watched before that just like help you realize
Mm-hmm.
to some extent what somebody might be experiencing as far as like sensory overload or in this case hearing loss.
Mm-hmm. These are some state programs that Michigan has them, but there's EDI all over the early hearing detection. So Ohio should have them as well.
Okay.
I'm going to talk about Guide by Your Side and Hands and Voices. So on the
Okay.
next slide, I cover Guide by Your Side. They provide family visits with an experienced parent of a child with hearing loss. So these are parents that have been through this, have been where you are. And they're trained to provide resources, strategies, and guidance. And it's a free service. So once child's diagnosed, and if they want to get that referral, Guide by Your Side is a great resource to have. Just there are things that parents that have gone through it can help you with and answer questions that a professional may not.
Right.
Like the everyday experience and the emotional support that may be needed. I think it's a great program to reach out to.
And you said it's through the state?
Usually when a child is diagnosed, especially early on, they get referral to early on. They're at least
Yeah.
in
Yeah, in
and
Ohio it's called Help Me Grow. Well, it used to be called Help Me Grow. Now I think they just call it early intervention. But
okay.
that's the
And this is
equivalent.
something that even if the state doesn't do, they have a website for every state. If you do a guide by your side, for example, Michigan, you get the
Okay.
website and you can just
Okay.
like submit and say, hey, I'm a parent. I would love to get some resources.
Okay.
Mhm. The next one is Michigan Hands on Voices, but again, Hands on Voices is a program that is across the states, ages 3 and up, and it's a group that supports families, like Guide by Your Side as well. These
Mm-hmm.
are not only families and people with, they're also people with hearing loss as well, and
Okay.
professionals are on there. So sometimes as someone gets older or a teen, like, I want someone that I can talk to. I don't want to talk to the parents. I want to know what they did or how they dealt with X, Y, or Z. So they do also provide help just raising the child along the way. It's hard. They offer meet and greets, trainings, playgrounds, and play dates, even if it's all over the state. So it's a nice way to connect with others that are going through what you're going through.
Mm-hmm.
The nice thing is they provide, you can get help with education. This is a new thing they launched. It's online learning is a new challenge during the pandemic. So this is a great resource that's free if you need help while you're working with your school and to make sure your child is getting the needs they need.
Oh, that would be super helpful.
Yeah, this is the Michigan one, but it's free, and what can work for one will work for the others. So there's
Right.
a link, so feel free to click it, see if Ohio has one. But again, I don't know much about it because it recently launched, but I thought it would be a great thing to share here and make sure
Okay.
parents are aware of.
All right.
Next slide. Oh, and this is just my contact info. I'm always here. I mean, I'm a new grad, but I'm learning as I go. So if anyone has questions, feel free to email me. I'll try to answer. If I don't know the answer, I'll put you in the hands of someone that does. So,
All right. Awesome.
yeah.
Well, thank you so much for being here with us today and providing us with all of this information and all these resources. I'm sure it was super helpful for families that are either going through this right now or even might be going through this in the near future and don't know it yet. So they can always, come back to this as a resource and reach out to you if they have any questions about resources, not about their child specifically, but I'm sure Pathway can locate some local audiologists if they need a referral of that sort. So
Absolutely. Thanks for having me. I mean, I tried to answer as much as I could. I'm still a student, but I feel like this information families should learn and
yeah.
know about. And then you probably know part of my lend, I'm making a family resource packet. And then
Mm-hmm.
I'm happy to share that with you and feel free to share it with the families.
Yeah, that would be perfect. I can, if it's on like Google Drive or something, I can share a link
It is, yeah.
to the document that way. So yeah, that would be awesome.
Of
All
course.
right. Well, thank you, Batul.
You're welcome.
And we still have some more webinars to come, so stay on the lookout for those. And we're excited to open our doors back up on Monday. And I hope everyone is staying healthy and well and continue to light the way for all abilities. All right. See you later.
Bye.